Hey folks, not only is it freezing cold outside, but for people who don't have stable housing, there is this worrisome threat of a bacterial infection called Shigella. So Shigella is a bacterial infection that causes diarrhea, and it's very common. There are about 200 million cases around the world every year, but what we are seeing is more and more cases in homeless shelters across the US and Canada, including most recently an outbreak in Toronto. The way this spreads is what's called through fecal-oral transmission, which means if you touch a surface containing this bacteria and then you touch your food, for example, and you consume it, the bacteria gets into your gut and causes this diarrhea. Now, the challenge for people who are in shelters or encampments is that it's very hard to maintain hand hygiene. They don't necessarily have running water, but not just hand hygiene. They don't have access to bathing, to washing their clothes. Food prep is often done communally, and if somebody who's infected is doing that food prep, then they spread it to everyone in that setting. The good news is that most people get over the infection by themselves over about a week. People who have a weaker immune system are, of course, more susceptible to severe infections, but the challenge is that some people can shed this bacteria for weeks and weeks after the original infection, and that means that they can spread it very easily, even after they have recovered. And for that reason, there's an effort underway to identify people who have this infection in homeless shelters and to treat them so that they have a shorter period of shedding the bacteria and spreading it forward. So this is an infection that can find its way into the community. Any of us can be infected. Sometimes there are foodborne or waterborne outbreaks, but right now we are definitely worried about and thinking about people who are in the shelter system.